Question 35. Community health nurse is a triaging victim at the site of disaster. Which client should the nurse categorize as a black? Priority 4. So the client who is alert has a sucking chest wound. ये आएगा रेड कैटेगरी में एंड द client who cannot stop crying and can't answer the question ये ग्रीन जोन में आएगी एंड द क्लाइंट whose abdomen is a hard a tender to the touch ये आएगी येलो जोन में एंड फोर्थ इज who is full thickness burn over the 60% of body. So these clients should be categorized as a black, which means injury is extensive and chance of survival are unlikely even with definitive care. So client should receive comfort measures and be separated from the other casualties but not abandoned. 36. The client home health nurse center at home of 80-year-old female who had a CVA brain attack 2 months ago. The client is complaining of severe headaches and the intervention should the nurse implementing first. आंसर इसमें रहेगा टेल द क्लाइंट फोर्थ to sit down and take her blood pressure. Because the number one risk factor of CVA is arterial hypertension, because the client has a history of CVA and is complaining of severe headache, which is symptom of hypertension. So the nurse should first take the client's BP. If it is elevated, the client need to be taken to the emergency department in the home setting, asking about the pain scale and would not affect the care the nurse provides. Question number 37. A client has been diagnosed with rule out bacteria. Meningitis and a nurse is assisting the healthcare provider with a lumbar puncture. Which intervention should the nurse implement first? Here answer is second. Tell the client to empty the bladder. The first intervention is to empty the client's bladder prior to the procedure. And what is the first option? Have the client lie lateral recumbent position. The nurse should assist the client to lie in a C position with the back as near as possible to the edge of the bed, but it is not the first intervention. Okay, and third is encourage the client to complete advanced directive. All clients should have the advanced directive, but it is not mandated by the law. And last one is keep the client NPO prior the procedure, so the client does not have to be NPO for this procedure. Okay. 38. I think health home nurse is scheduling a visit for a day. Client should the nurse visit first. जिसका L4 spinal cord injury is who is complaining of a severe pounding headache. आंसर इज आई थिंक हाँ 38 का 4 है क्योंकि C5 spinal cord injury who reports redness drainage hello waist side. So here the client is reporting an infection at the insertion site into the bone which can lead to osteomyelitis. Okay, so these client exhibiting the potential life-threatening condition and should be seen first. Question number 39. The clinic nurse is triaging client's telephone call. Which client should the nurse call first? $39. का आंसर है 4. The client whose friend has botulism who has vomiting and abdominal cramping pain. Botulism is the most serious type of food poisoning and the client is exhibiting signs symptoms of it, therefore the nurse should return this phone call first. And what about 3? A client is a trigeminal neuralgia with having a light. Classic feature of trigeminal neuralgia is a excruciating pain describing a burning, knife like lightning like shock in the lips. Botulism is the most serious type of food poisoning and the client is exhibiting signs symptoms of it, so therefore the nurse should return this